Mississippi families wants to raise awareness about a bacteria that took the life of a man who loved living life on the water.
Well, Meg Ferris explains this potentially deadly risk and why it's so dangerous during the hot summer months.
Since he was young, Basil Kennedy loved being on the water, whether it was sailing or fishing near his home in Bay St. Louis or the camp in Point a la Hache. The only thing better was doing it with family and friends at his side.
Basil was one of these guys who liked to bring people together to enjoy each other's company. And it was always just fun being around him. You knew you were going to have a good time.
But recently, Corky Hayden was asked by the family to give the eulogy of his dear friend.
I said I would be honored to do it. I said, I'm not sure how I'm going to get through it, but I did. And it was a very nice thing to do, to relive a lot of the good times and a lot of the good things he did with his life.
At 77, Basil picked up a common bacteria that rises in brackish water during the hot summer months, Vibrio vulnificus. It is believed to have gotten into a scrape on his leg. Medical Watch has been reporting on people infected during the summer for 30 years. But this year, there's more. The Louisiana Health Department has seen 17 cases and 4 deaths. In past years, on average, only 7 cases and 1 death.
And it's not just a Gulf coastal phenomenon any longer. Global warming is moving infections with Vibrio vulnificus up the East Coast. Cases are being reported in Connecticut, New York, much less in the Chesapeake Bay.
LSU Health infectious disease specialist Dr. Fred Lopez says you can get it through the water touching a small cut or wound or by eating raw shellfish. Healthy people could get gastrointestinal symptoms, but for people with compromised immune systems, it can lead to amputations and even death. Those include liver and kidney disease, cancer, diabetes, compromised immune systems, organ transplants, AIDS, alcoholism, cortisone treatment, and taking stomach acid suppressant medications.
People with those immunocompromising conditions shouldn't go into those waters during the warm summer months, nor should they be eating undercooked or raw shellfish.
Basil had diabetes. Even with good care, the infection took over in just a few days. Still, he did what he loved until his final days.
Along with having fun and fellowship, he also gave back a lot to the community. He was a good Christian and devoted a lot of his life to making our community and the coast a better place to live.
Meg Ferris, WWL, Louisiana.
There are about 200 infections a year in the U.S., but it is the #1 cause of seafood-associated deaths.